Thank you all so much to all my labor brothers and sisters for being here and for being so engaged, especially not only during times of elections, but actually times on issues like this. So many of us will always be engaged on those kinds of what I call candidate committee campaigning, all that stuff. But in between all that is where we got to get real work done. And that's where you all come along, and I really appreciate you all doing this, especially I know that you've been doing this on Mondays, getting together, especially around the need for universal health care in our country. As you know, I is one of the one of the original co-sponsors of Medicare for All, and that's something that you all wanted me to talk about today, correct? I just want to make sure. Yes. So you all know that there has been increased momentum. I think there's over 130 members of Congress now that endorse it. There's no private insurance premiums, co-pays, deductibles. What I love also is that it includes long-term care services. Many of us don't even think about this stuff, but let me tell you, it is coming, and it's always sometimes right around the corner where we need that long-term care coverage that makes sure that we're at least, have some sort of dignified human care for us in our elderly age and as we become seasoned residents. It also reduced the cost of prescription drugs. The United States currently pays the highest prescription drugs in the world. We have a number of House committee hearings. I sit on House Oversight Committee. The first hearing we ever had was on prescription drugs. And this mother who lost her 6-year-old daughter because she couldn't get her access to insulin, lost her 6-year-old daughter. And every single other person that testified talked about that. But you know what came out of that hearing, and this is my first hearing ever as a new member of Congress, was the fact that us, the public, all of us, we pay 80% or more in research and development of these drugs. Did you know that? We subsidize. So we're the ones who pay to develop these drugs. And then they go out there and they go throughout these patent loopholes, and then they go and monopolize it and charge thousands and thousands of dollars. Why that's important for you all to know, so those ads, those ads you see all the time on TV? Do you know some of the portion of that is tax deductible? Did you all know that we pay for those ads?
No, I didn't.
Not all of it. Did you know? So these are things, as a new member of Congress, I'm sitting there in my first committee hearing in House Oversight. I was so taken aback because you hear pharmaceutical companies tell you, well, it's so costly to research, to develop these drugs, the scientists and everything. And for us, because this is so foreign, we're like, yeah, for sure. But then what did the federal government do? They said, no, we're going to go ahead and we're going to figure out a way to pay for that so that we can make it more affordable and accessible to all of us regular American folks. And it didn't happen. Corporate greed took control of what is happening now to our healthcare system, and we got to push back. And so with Medicare for All, the legislation authorized Medicare to issue licenses to allow generic production of generic production of a drug if the pharmaceutical company refuses to negotiate a reasonable price. So we're going to compete with these folks. We're going to push back against their corporate greed. And again, Medicare for All to me, gets us closer and closer to true universal health care. As you all know, even when we pass anything that we decide to pass, and this will pass, it may not be right away, but I think we're getting closer and closer to building momentum for Medicare for All. But we got to make sure that it's implemented the same way. All of us understood the importance of covering more people. You know how there's so many people that are uninsured. Well, Affordable Care Act came along, right? And covered more people, but guess what? It was less coverage. And now more of the private healthcare companies are made record profit under Affordable Care Act. So know that a lot of this stuff can't be done perfect until we make sure that it's implemented the right way, right? So this, to me, my generation is now pushing this forward, and this new member of class, a very, very diverse class, not only in our ethnicity, our backgrounds, but the fact that some of us have never had health and care insurance before. A couple of my colleagues, one has a pre-existing condition, another literally lost her mother to the broken, inhumane healthcare system. So a lot of the new members of Congress understand what the broken healthcare system has done to the lives of regular folks. So when that committee hearing happened, for me, I was like, yeah, this is exactly what's happening in my residence. But what I didn't know, and what I learned, and what I thought was completely unfair, is the fact that our tax dollars are being used to develop these drugs, and they're turning around and making record profits off of the back of people dying because they can't get access to the medication. So just know that we're going to continue pushing forward on Medicare for All. I believe we're going to have one more committee hearing on it. One of the co-chairs for Medicare for All caucus, which I'm a member of, is Congresswoman Debbie Dingell, who's been fantastic on this issue. And so if you ever think that we would want to have a town hall together, anything like that, to educate people, because what's happening, and they do this all the time, is they gaslight people to believe that this is what's going to happen if we do this. This is what's going to happen if this happens. Let me tell you, when I go see second and third graders at all the schools around my district for March Reading Month, the kids, they don't know what I do. I mean, they're second and third graders. So I'm a member of Congress. They'll always ask me about the president and stuff, and I'm always really good. I am. And one of the things that I say to them is, when I was your age, we used to go to a restaurant. You know how you go to a restaurant with your parents? And I say yes. And I was like, how they'll say, do you, how many people in your party? They're like, all the little kids nodding their heads. I was like, do you know when I was a little girl, they said smoking or non-smoking section? And the kids were like, what? And I'm like, they used to smoke at restaurants. And I'm like, yep, they did. And they're like to me, well, what? And I said, at hospitals. What? And planes, airplanes, no way. And I said, but the whole time, scientists and doctors were saying to people that you actually can die, that it was actually hurting your lungs. Secondhand smoking was worse than directly smoking, right? Yeah. But it's just having the truth out. No matter if you're a smoker or not, it doesn't matter. The fact is that the companies that were making money off of people getting sick and not letting them know that it's worse to smoke near your child, all those things. You may think it's common sense now, but back then they were like, no, that's not it. It's all those other circumstances. It's all the junk food we're eating. You heard it. Oh, what about the pollution and the other, all those things. But at the end, it took all of us and movement from people to say enough is enough, that there was too many people that were literally dying, had never smoked in their lives, but were dying from lung cancer because of secondhand smoking. And so I tell the children, what I do is I try to make sure our air stays clean. And I said, how many of you have asthma? And a third of the class will raise their hand every single time. I don't care if I'm in Redford, if I'm in Romulus, if I'm in the east side of Detroit, a third of the class will raise their hand, especially in Wayne County. And I tell them I'm trying to make sure we got clean air, because all of what you see is causing dirty air that makes you sick, and sometimes you can't go to school, and they're all nodding their heads. And I tell them also, right now there are going to be people that say, well, there's no other option. But it's our job to figure out how can we have a healthier communities, be able to have our children not have to go through the challenges, to have these high rates of asthma. People in one of my zip codes has 3 times higher rate of asthma hospitalization among adults. All of those things. But you hear people right now, right, saying that's not really happening. That's not true. All the same things you hear now. They're doing the same thing to Medicare for All. They're saying this is it's going to get worse for you. It's going to do this and that. But the point is, until they admit the system is broken now, it is so broken, folks, that I have this drug that will prevent HIV detection, literally. I'm sorry, getting HIV. This is a huge, huge issue, right? And they're preventing it by charging close to $1,700 when you can go to, I think it's Australia, you can pay for it for $21. So admit this. They need to admit that it's completely broken. That the way the access to drugs, access to our care, access to something that, for me, it can't just be about covering people, making sure everybody has health insurance. It has to be a humane healthcare system they have access to. Yeah. It has to be covering the drugs they need. It has to be not going through the layers and layers and layers of bureaucracy that I hear this woman who says she has a rare disease, she gets breast cancer, they take her off her drugs that she needed for her rare disease so she can get chemo. Well, she went back on her, she said, okay, I'm done. I've fought cancer. I don't have breast cancer no more. I got to get back on my other drugs. The insurance company said, well, you lived with it without it before. We're not going to give it to you anymore. Say what? Exactly. Exactly. That's how broken the system is. So don't let anybody, I don't care who they are, Democrat or Republican, to gaslight you to believe Medicare for all is not going to get us closer to a much more humane healthcare system in our country. And so with you all on the ground, grassroots effort, that's what's going to happen. This bill does not pass without movement work outside of the halls of Congress. We will not be able to fight back corporate greed or the corporations that would try to gaslight all of you to believe it without you doing something about it in the community. And I do want to spend a little bit of time about some of the other bills I'm working on, and it's so important. So you all know the GOP, the Trump tax scam, I call it, was passed. It gave huge tax break, corporate tax break to the wealthy. Forever. Shareholders, not forever, we can repeal it because I'm going to tell you how we're going to repeal. So, we can repeal everything this president has done the last 2.5 years, not only in 2020, we can continue to push back. I'm telling you, the damage is so, it's not just the hate agenda, folks. It's the fact that many of it's being implemented through executive order, through a lot of changes that are being done that you probably don't even know that's happening at HUD, that's happening at the EPA, that's happening at all different levels of government. I have never thought that as a new freshman to Congress, that I would have to hold 3 members of his cabinet in contempt. The Attorney General in contempt, the Commerce Secretary in contempt, and Kellyanne, I don't know what she does for him, but we held her in contempt. So the point is, I just want you all to know that we repealed it. We took all of that, what he did. I mean, this is huge. You don't understand the shareholders, GM, all of them. Yeah. Huge amounts of shareholder, like winning, whatever they call it, payments out to them. I went and introduced the Boost Act, and they're like, in the bill it says where I get the money from, and they're like, what is this? I said, if you make less than $100,000, you can get up to $6,000 in tax credit. You could be a caretaker. You could be, and folks, some of us are familiar with earned income tax credit, but a lot of my neighbors do not qualify for earned income tax credit because we're making a little bit too much. And people think like that's a living wage, that somehow we have a good quality of life when we make, no. Because no matter what, they all keep telling us, you increase minimum wage, Rashida, the milk's gonna go up. I said, the milk's gone up. So, I don't know, isn't it like, Rashida, well, you can't do that, the products are gonna go. I said, what are you talking about? Everything's increased. Everything's increased without us increasing wages. So stop gaslighting me or try to mislead my residents to believe that somehow it's gonna be connected. No, you're all increasing it anyways. You're all doing it anyways, and it's our job to make sure that when they do it, so do our wages. Our wages should go up. Going back to the Boost Act, this is hugely historic because it expands the people that can get a tax credit up to $6,000. You can get $250 a month during the time if you make less than $100,000. And you can be a caretaker, a student, somebody on disability, on retirement. As long as you have less than $100,000, you can get up to $6,000. Now, if you make less than $50,000, not a family, single person, you can get up to $3,000. Do you know how many people would be uplifted out of poverty if we did that? Yes. 45% of Americans would be lifted out of poverty if we just repealed the GOP tax plan and put it in the pockets of all of you. And most of my folks, the majority of American people, you give them that money because they're $400 away from an emergency to get them back into a cycle of poverty. And you all might not even know you're in poverty. Do you know how many residents, you all don't even know. No, really. But if you can see just one little emergency in your life can trick you out into trying to get this out of this cycle. And so the Boost Act has gotten a tremendous amount of national support. Local organizations in the 13th Congressional District have come out and supported. So when people say, what do you want to do with you say boost. We want to boost regular folks. And I know when I put money in your pocket, you go right out and spend it right into the local economy. Every time I would even do people's taxes and folks, I would say, oh, you're going to get like, $1,000 back. What you going to do? I'm going to get new carpet. Because what does that do? It increases local job kind of creation, and it continues to support our small businesses. We always do that. When the GOP tax plan came, they said, oh my God, this is going to be great. It's going to fuel our local economy. No, it didn't. It didn't. It actually, poverty among children in Michigan has actually increased. Did you all know that? the kids count just came out. So it didn't work. So I'm trying to show a point when they say we can't pay to try to end or try to address the concentration of poverty, especially among my seasoned residents right now. So many are living literally disability check to disability check. And so we got to be able to boost everyone up. And so the Boost Act does that. The last thing I want you to know, so very limited to what I can do about auto insurance on the federal level. But the number one issue I heard is auto insurance. And let me tell you, we lost more black home ownership in the state of Michigan, but even in communities like Redford Township, other areas, I see huge increase of renters versus home ownership. Why is this important? Because most of us right now are paying a mortgage payment to our car insurance, like literally. No, it is. It's a mortgage payment. And not only that, University of Michigan did a study showing that it actually keeps people under low wages because they're paying thousands and thousands of dollars every year. Because you're paying 6 months, you might be paying a certain amount, but it's thousands of dollars. Even if you're outside of the city of Detroit and you're like, well, I'm paying this much, I show them, no, that's actually still very high. It is. You're paying excessive amount. We pay the most in rates of auto insurance than any other state. So what I can do under House Financial Services, under the Chairwoman Maxine Waters, I sit on both committees, House Oversight with Chairman Cummings, and I sit on House Financial Services with Chairwoman Maxine Waters. I introduced 2 separate bills. We had a great hearing on one of them that basically says that you can't use any other, any factors, no giant, so marital status, education level they use gender, they use all these credit scores, they use all these non-driving factors, which are proxies. Really, proxies is discriminate against all of you. All of that should not be used. When a study came out and showed someone who had a DUI, drinking under the influence violation, was paying 300% less in auto insurance than somebody with no DUI, but a decent credit score, that doesn't make any sense. Why is that person paying 300% more when their driving record is clean? Because of their credit score? So I just want you all to know that has nothing to do of whether or not you drive safely or not. Your education level has nothing to do with whether or not you're a safe driver or not. So when Congresswoman Debbie Dingell came up to me, because she knew I introduced both of these bills, and I got 30 sponsors for one of them. She came running up to me, she goes, guess what? And I said, what happened? She goes, Congressman John Dingell had passed away. Her car insurance went up $2,000. Ask her, I'm not exaggerating. I said $2,000. She goes, my car didn't change, my driving didn't change, nothing changed. I lost my husband, I became a widow. When a woman that works at Beaumont for 25 years, she retires, she gets a retirement, she gets a fixed income, it impacts her credit score, right? It just becomes just a little slight difference. She pays $350 more now and because her credit score changed. That again should not be factors they should be using towards our auto insurance rates. And so something on the federal level I can do is push back and say these are factors you can't use nationally. And already other states have prevented it. Yes, the governor and other folks have supported this initiative that came forward, but know this. In the bill that I introduced, I specifically say no more using zip codes. Where that one had more talking about they can use territories. I don't know the difference. Then the other one is you can't use credit scores. And here in the state they passed something that says you can use your credit history. Again, I don't know what the real difference is. The point is all of this, no matter your ethnic background, no matter your income background, no matter your education level, all of this, these are proxies to discriminate against you and jump up your auto insurance prices. And to me, I'm done with them using these kinds of proxies to do that. It should be based solely on your driving history and your driving record, nothing else. And so just know those 2 bills, I introduced it with Congresswoman Watson Coleman from New Jersey. Huge issue for her in her state. So we're both been really pumping it up and trying to educate people about that issue. Lastly is the one bill that I will be getting passed out of the House is a bill that says if something's on your credit score, you know how it's on there for 7 years, the famous 7 years? Well, studies have shown that it's not a good indicator whether or not it's not a good indicator whether or not we should be loaning or whatever. So the credit score, the credit report, any debt on there should be reduced from 7 years to 4 years. So it got passed out of the Committee of Financial Services. And so something you did when you're 18 or 19 or 20 years old shouldn't be on your, when you're 27 years old, you want to buy a car, you want to buy a house, it shouldn't be something from your, ER, visit, whatever it is. The other really important part of this bill is not only does it reduce it from 7 years of the debt being on your credit report to 4 years, but it also removes any medically necessary procedures or any billing from that on your credit report. So those two things would be removed from the credit report, and again, reducing the time period. And we're expecting that to pass out of the House, and then you guys gotta help me get Moscow Mitch to support it. So the last thing is, this is really helpful. If you got the newsletter, please know I opened 4 neighborhood service centers throughout the 13th Congressional District. So if you're a resident of mine that lives in Western Wayne, the neighborhood service center is in Inkster City Hall. Monday and Wednesdays, my caseworker is there to help you, so you don't have to come all the way downtown or anywhere. I'm not downtown, but you know what I mean. And then same thing with my folks in downriver. If you live in Melvindale, River Rouge, original Southwest Detroit, Ecorse, River Rouge City Hall, Monday, Wednesdays, and Fridays, my neighborhood service center is open. Why is the service centers important? And then 2 in Detroit, 1 on the east side and 1 over there on 2nd and Pallister. It's all in here. Why these are important? Already some of my UAW members call me about certain issues that happened to him. I have one a veteran disabled, had $121,000 in college debt. But for the fact that he called the service center, I would never have known there was a program. We wiped it out. Do you know how good that felt? I felt like I won the lottery. No, I was so happy. Another woman, she had her Social Security, she got hearing impaired. She couldn't hear from one ear. She applied for Social Security, something she paid into, she deserved it. There was an administrative error, something was going on. She didn't get it for over a year, been fighting for it. She was so worried that somebody was gonna come repo her car. She kept looking at her driveway, checking up on her car. And we found out by just calling from the service center, and it found out it was an administrative error, and we got her $38,000 in 1 week. So just know the neighborhood service centers are where you can get some of the strongest constituent services programs. Plus, it's where I get my bill ideas. Most of the stuff that I'm introducing on environmental issues, on issues around credit reporting, anything like that, is really coming from some of the cases that I get at the service centers. And I want you to know, the power of the letterhead can be transformative. This woman, she works for one of the big threes, her husband does, and she was paying $2,800 on her insulin. They changed the coverage. And I know, she was paying like less than $300. She called me, she goes, I don't know what's going on. Well, I found out the Trump administration changed some tax codes, something, and we don't know if that's the reason that this one of the big three decided to change their health insurance. But let me tell you, they said that insulin wasn't preventive care. How many of you know that it prevents death? Insulin prevents death. Yeah, that's what I thought. So they literally redefined it so it wouldn't be covered the way it was covered before, right? So I used the mission statement of the company in the letterhead and said, this is what your mission statement says. But then you're gonna go ahead and listen to an administration that pretty much is demonizing sick people and targeting them and trying to save money so they can get corporate tax breaks for their friends. And she went to go pick up her insulin the month later, and she paid $244. So use my office to advocate. Most of the things that are now in the books and things that are going on with different departments, all of that, we gotta make sure that the government is working for us. Because I can pass bills all the time, but if I don't make sure that it's being implemented the way it's supposed to have been intended, then it's never going to work. So please raise the bar of what you expect in your members of Congress. Ask them to help you with your everyday challenges. Don't just call us to vote yes or no on certain issues. Call us to make us work on your behalf, and go and call the IRS, call Social Security, call all those folks. Thank you so very much. I really appreciate it. Do we take questions? Because people are raising their hands. Yes, go ahead.
I got a son, he's disabled, in a wheelchair.
Yeah.
21 years old, 27 now. And I submitted an application for a wheelchair for a standing wheelchair, which is really neat. Blue Cross told me that the candidate was under 21 years old. I called
No. So let me tell you something about the insurance companies. They always say no.
Right.
No, they always say no at the first, and then we got to go fight and keep knocking down. No, we do it all the time. So what I would like to do is get your information and then go fight on your behalf, because sometimes our office calling on your behalf elevates the issue. So then, and it's so sad that it has to be done that way. But if your member of Congress is like, I'm calling on behalf of one of my residents, and you're not allowing him to get a wheelchair, he's got coverage for it because of you're saying, is there an age out? Because I didn't hear about this age out. I thought it would. So anything like that for me to create some agitation for you to be able to get a wheelchair for your son. So my staff is right here. If you can get your information to me, I would really like to be able to push back. Yeah. Yes, sir.
We be having a lot of meetings in a lot of pockets, but I just want to let you know that you got an army at your disposal.
That's right, that's right.
All these people have experienced all the things that you say, and these people are here because they want to do something, and you telling them what to do, but you got an army, and all you have to do is organize it as one, and we can have a mass rally, either Lansing or Lansing and Washington, and believe me, they don't want to see wheelchairs and canes and respiration in Lansing. We can come together. You got the retirees, you got the seniors, you got an army. We can get their attention.
Yes, you do. We are
Use
fighters.
us.
Okay.
Use us.
I
We
will.
are fighters. Yes, we are.
I will.
Thank you, Gus. That's what
So,
I'm talking about.
Gus, I want to, and you can help me organize folks here. So my goal and my passion has been to try to bring Congress to my district. What I mean by that is having more field hearings, because I think we need to have more field hearings. In the last 7 months or 8 months now that I've been a member of Congress, all these committee hearings up in DC, they're good, they're important. But a lot of my residents can't get there. They can't come and see what's actually happening, but also they can't share. So we just had one on the housing crisis, what happened with the tax foreclosures, everything, and just recently with Chairman Al Green. But now I'm vice chair of the Environmental Subcommittee on Oversight, and we're coming September 16th at Kemeny Recreation Center. September 16th at 1 o'clock, or 2? Okay, we'll double check. But I'm gonna give my colleagues a toxic tour with my residents to show them what's happening there. And I know this, but to me, this is so interconnected in the fight for Medicare for all and for health care coverage, is the fact that we also have to fight back against any no accountability on corporate polluting that is happening now. It is gonna be talking about access to water. It's gonna be talking about, talking about the water shutoffs, but more importantly, access to water and what's been happening because the for-profit industry is vultures. They want our water, and they already got majority of it, and they're taking it and they're bottling it and then they're giving it. So we gotta push back. And so we're gonna be talking, we're gonna have a panel of residents and folks. But I really would love to have, labor support there saying, we're here for Medicare for all, we're here for this, but we also have a right to breathe clean air, and we have a right to clean drinking water. And so that's again September 16th, 2 o'clock at Kemeny Recreation Center, right by Marathon.
We can have fundraisers for buses.
Yeah.
You got hot eats and beats for 3 and 4 days. You got stuff for 4 and 5 days. We could be able to have fundraisers.
I'm gonna take you up on that, Gus, and I don't think you're gonna fundraise. No, I'm gonna take you up on getting a bus.
He's down.
You gotta get their attention.
Gotcha.
You can't do it all by yourself.
Got it.
We willing to help.
That's
Get us
right.
in.
That's
Hey, I think my staff knows Gus is gonna get a call every week. No more.
I want
Yes.
you to get,
Yes.
she's had her hand up a
Yeah,
long
please tell me.
time.
Yeah. Do you know her name?
As long as you're good, let me know.
And it's a matter of life and death, the use of the EpiPen.
Yes.
Is there any movement to reduce that?
So Medicare for all at least gets us to include obviously any prescription drugs, and that's considered a prescription drug. But what do they call JRE? There are young people that use the pen now have met with me 3 times, talking specifically about what we need to be doing. I think Medicare for all gets us closer to that. We also have a number of prescription drug bills that we put forward. But again, it's gonna have to be telling the truth and getting out there, because that's the one thing is, we've been taking it from the pharmaceutical company, making them seem like, well, of course, it's must be expensive. But when I found out it cost them almost nothing to really
Right.
produce, and because we were covering the cost of developing the drugs, I'm so completely disgusted.
Right.
And it was traumatic hearing this woman talk about the drugs she needed, and this young woman who's 23 years old, who started crying, talking about taking her life because she didn't want to be a burden on her family, having to pay thousands of dollars for insulin for herself. And so I just want you to know, it has become such a huge crisis in our country. We're trying to bring like the human impact there, because I think I'm as angry as many of you in this room, but those are the powerful stories that feel like may shift some of my colleagues to understanding the sense of urgency that we all feel right now. Yes. Am I getting the right person?
You're good, man. Whatever you're good with, you should.
And I learned a lesson many years ago in the north end of the Capitol, in the state neighborhood.
Wish we had a mic out there.
That's okay, I'll repeat it.
We used to have one when it broke, I think.
We went door to door in the neighborhood because we could follow up. We knew who wasn't registered in the neighborhood, and we would go back, and we got everybody registered. And you could use those lists. And in a May election, we turned out 85% of the registered voters. It concerns me greatly. I mean, I agree with all the issues that are all positions on issues. The bottom line is, who votes? And what I see that even in Detroit, we had in a May election an 85% registered voter turnout. By knocking on doors to register people and then knocking on doors to turn them out, it just concerns me. I wanted to ask you if you know anybody who's taking a big leadership role in terms of registering voters in Detroit and the area.
So the great news is we passed Promote the Vote. Proposal 3, right now you can go online and register. You remember we used to have to do the paper stuff? How many of you do registration to vote? Yeah. So all of that now can be done online for some folks. But let me finish. The one thing too is, like, that's great for our young people in high school. That's great for those folks. The fact that you can also register the same day. So you don't have that other layer of having to worry whether or not somebody's registered and having put so much effort into that, where we can just focus on turnout. Because if they show up at their polling location, they can register to vote right there and vote 5 minutes later.
Wow.
So yes, you also don't need any more excuses to get an absentee ballot. You don't have to be over 60. You don't have to. You can just want it mailed to you. You can get it mailed to you. You can go pick it up. It makes it so much easier for even our college young students and those folks. But Promote the Vote, something that I think, we can get somebody from the Secretary of State and others here, even the clerk's office, to come here and talk about it to all of you so that you can educate people. Because I still got people questioning whether or not they need an ID. I said, no, you don't need an ID. And then, where do I go register? What do I do? All those things. It is so much easier now. Michigan is now one of the more progressive states when it comes to access to voting, because you don't need to pre-register. You can do it the same day. You don't need an excuse to vote absentee or any of that. Now, what gives me hope is the 13th congressional district in the last non-presidential election year expected about 60,000 people to come out to vote, which is very low, but that was the high end that we thought would come out to vote. In that election year, 13th congressional district, we had 108,000 people show up. So there was a 60% hike of turnout. This last non-presidential, usually don't have this kind of turnout in a midterm election. We got to continue that momentum. But I think partly it was a lot of other things. Of course, it was a referendum on who was in the White House. Absolutely, I heard that. Because this was interesting, because even when Obama was on top of the ticket, President Obama was on top of the ticket, people kind of was like, happy and moving, this time around, they were marching. They were like, get out of my way, I gotta vote. There was this movement, energy that I never felt before.
Wow.
The one thing that I sense though is, and I'm hearing folks, if you look at what was on the ballot, it wasn't obviously just, the governor's race and all these other things, but it was also, was also the ballot measures that were on there. And I feel like that motivates some people to come out. because I've never seen any movement around like Proposal 2, which was all about redistricting reform. I saw people so motivated, volunteers getting out about having much more fair democracy in elections. People came out because of that proposal. And honestly, and I'm gonna be honest, the freeing the weed, they hate when I say it, I don't care. But that, I'm not joking. I was there somewhere and this guy was like, I'm coming. I was like, what are you coming to vote for? He told me exactly what he was coming to vote for. And yes, the legalized marijuana. No matter where you are, stand up. But this is me being at so many polling locations, moving throughout Wayne County, from Romulus to Inkster to River Rouge to Ecorse, the east side of Detroit. There was a commonality that everybody had different reasons for coming out. Trump, ballot measures, all this. We gave people a variety of things to come out. There was the energy around that. And so I hope we do that. I hope it can't just to be about the top of the ticket. And, you know, Denzel doesn't like me saying this sometimes, but I want to say it. In the last presidential election year in 2016, there was close to, I think, 90,000 people that came out to vote. Millions of people came out, but 90,000 people came out to vote. Got in line. They voted for everything on the ballot except at the top of the ticket. They left it blank. They didn't vote for no third party like everybody wants to blame. They didn't. But I say that because the top of ticket freaking matters. It matters. If there's not going to be a person that supports Medicare for all, we got a problem. We're not going to beat Trump. If it's not going to be somebody that supports really aggressive, move around environment, move around ending poverty, move around education reform, all of those things. We have to have all of these issues be wrapped around who's going to be on top of the ticket. It can't just be somebody, that could, all these little nuances that people bring into it. It doesn't work that way. And I truly believe in direct human contact. When you said door to door, you spoke to my heart, because I'm telling you right now, people, the things they say about me, it's unbelievable, even during the campaign. But when I came face to face with people, it was transformative for them, because it was like they got to be able to talk to me, see me, and ask me the questions they needed to ask, and all of those things. So direct human contact cannot be underestimated. We could do mailings. We could do these ads and billboards. Nothing will matter the most except for door-to-door touches and directing people. That's how you change the hearts and minds of people, and how you convince them to come out and vote is when you talk to them directly. Yeah. Yes, sir. So there is an organizing core within the Democratic Party. There's these young people. They already had a community conversation. We can connect you to them. There are all these incredible youth. How many did they hire in Michigan? A lot. They're everywhere. I don't know how you should bring them here. There's such a burst of energy. It's unbelievable. But they are all out doing events around Medicare around healthcare, around. They had a cupcake and conversation with myself and a number of other elected folks in the west side of Detroit. They're all over the place, and they all been hired by the National Democratic Party.
Yeah, I'd like to know, I guess, is there anything the federal government can do with Congress to stop the lead poisoning of children?
No.
Particularly in Flint, around the Flint, that is a huge problem. Is there anything that the federal government can do?
Yeah, and please come September 16th, because we're going to have two people from Flint talking about the fact that Flint hasn't been fixed. There's a myth out there that it's all been done, it's all fixed. No, it hasn't. Not only that, we have to take care of the people we allowed to be poisoned, because lead poisoning can't be reversed. It's in their DNA, it's in their blood forever. So just know that. But September 16th, that's going to happen. The other thing I think is important here, especially in the state of Michigan, is advocacy around, I truly believe until we can tax breaks for corporations and for for-profit development, period. There should be a complete halt. I mean it, a complete halt on it. They will dance around and come to you all, and they do it to my labor organizations and labor leaders all the time. Look, jobs, jobs, jobs. Well, guess what? Jobs don't fix cancer, nor do they fix our pipes, nor do they don't do that. They're for-profit development corporations that can afford to do development by leaving our infrastructure stuff harmless, having our tax dollars actually go into our schools, all those systems that are in place that we all pay. We pay for that. We don't want it to be shifted away to go into a stadium. Sell more pizza. Why are you taking money out of classrooms for a adult playground? Period. Until we all as a community and labor organization stand up to this myth that if they don't do it, they're going to go somewhere else. Well, then great, go. Because I've got kids dying because they don't have access to water and to health care and to all of those things. And I just want you to know, I'm really tired of it. I'm tired when our economy is doing well, that we still can't get our education system up and running, that we still can't get our infrastructures up and running, that we still can't fix our roads. Until we deal with the fact that when we are doing well and revenue is up, that we shifted array towards these for-profit, big-scale development projects. To me, guess what? Reduce the shareholder givings. Reduce all the other things that you have without you getting in the corporate welfare line and getting these big tax giveaways. You all think I'm oversimplifying. I'm not. Look at the last 20 years. My God, we gave $175 million to Marathon, and they gave us 15 jobs. And guess what? They produced petroleum coke that they dumped on the riverfront with no permitting, nothing. We can't even burn the stuff here. It's so toxic. So what did we get in return?
Nothing.
All of us are subsidizing the health impact on our neighbors, and they get away with it. Nothing. Well, guess what? You promised 100 jobs. Give us our money back, period. So I just want you, I'll end with this. It is something that I want you all to really, really push back against when they come and show up and they say, well, this is really important. This is what we need to do. And that's the thing too, and you know this. Our UAW jobs are not the same they were years ago. When my father worked at Flat Rock and Downriver at the Ford plant in Flat Rock, he had a job that gave me straight teeth and glasses and none of these high costs, nothing. These tier 1, tier 2, all of these kinds of things. You know what it is? They always will try to dismantle the power of the people in the labor community. And we can't allow them to do it because they're going to pin us up against each other. And that's how they do it with the tier 1 and tier 2 and full-time salary, non-salary. Don't let them do that to us. You know, my dad passed away before he could see me get elected. But my God, this man he went up to 4th grade education. 4th grade. He came to this country at 19 years old, sold watches on the street. You know, he hustled until he got a job at Ford. Finally, first time he ever got a paycheck, first time he ever got health coverage, he was able to retire with some sort of human dignity.
Yeah.
And he got a daughter now that's a United States freaking Congresswoman. Why? Because when I turned 18, he didn't say happy birthday, girl. He's like, go register to vote. Why? Because the UAW brainwashed him to believe nothing matters but voting and making sure that people power comes first. So please, believe in the power of this organization that built up the middle class in our country. And don't you dare let them lie to you about Medicare for all, lie to you about these big tax breaks, all this other stuff, because our kids are the ones who deserve clean water. Our kids deserve classrooms that are not overcrowded, that the fountains are not closed down because it's lead-infested water coming out of the fountains. All of those things. We all need to believe that we deserve to live with some sort of human dignity. And until we choose ourselves first, they will always win.